In a nation where vaccines have become as central to public health as water and electricity, the path to eradicating diseases, well, it's not so straightforward. As Republicans continue their anti-vaccine agenda, forcing Democratic states to form their own vaccination policies, your safety in the United States from diseases like polio, measles, hepatitis, and COVID-19 now depends on whether you live in a Democratic or a Republican state. In the United States, your safety from diseases like polio, measles, hepatitis, and COVID-19 now depends on whether you live in a Democratic or a Republican state. In fact, the beginning of the resurgence of such diseases has already begun with measles. This year, the United States has reported around 1,400 cases of measles and at least 3 deaths. More than half of these cases were reported in the Republican Texas, and 2 of the 3 deaths were also reported in the state. As Republicans continue to pursue anti-vaccine agenda, there is a clear division among party lines on life-saving vaccines. While Democrats have embraced vaccination, Republican leaders have shunned them over conspiracy theories, religious beliefs, and purported libertarian ideals. The Republican-controlled Florida on Wednesday announced an end to all vaccine mandates, the first state to do so. Joseph Ladapo, the Surgeon General of Florida, said that the state had no right to tell people what to put in their body, as the body is a gift from God. He went on to say that every last one of them, vaccines, is wrong and drips with disdain and slavery. More from World, Florida's decision, which came in the midst of U.S. Health Secretary Robert F. Kennedy Jr.'s continued disinformation campaign against vaccines and dismantling of vaccine-related policies, prompted the Democratic states of California, Washington, and Oregon to form the West Coast Health Alliance. Under the initiative, these Democratic states will form their own vaccination guidelines, as RFK Jr., as Kennedy Jr. is hauled, has essentially killed all federal vaccination programs and research and development. From Make America Health Again to Make Diseases Great Again, with the removal of all vaccine mandates, the Republicans in Florida and any other states that follow suit are at the risk of resurgence of diseases that have been nearly eradicated in the United States from vaccination, but could resurface if vaccination rates fall, such as polio, measles, chickenpox, and rubella. In fact, the beginning of the resurgence of such diseases has already begun with measles. This year, the United States has reported around 1,400 cases of measles and at least 3 deaths. More than half of these cases were reported in the Republican Texas, and 2 of the 3 deaths were also reported in the state. The epicenter of the outbreak was the Mennonite community in West Texas, where the vaccination rate was 82%, well below the 95% required to maintain herd immunity to prevent disease outbreak. Overall, around 70% of cases were reported in unvaccinated persons. As a result of consistent anti-vaccine agenda of far-right figures, vaccination rates have fallen up to 70% in some areas, according to reports. Health Secretary leads charge against healthcare. Health Secretary Robert F. Kennedy Jr. has emerged as the biggest anti-vaccine activist in the United States. Since assuming office, RFK Jr. has fired all 17 experts on the U.S. Centers for Disease Control and Prevention's CDC Vaccine Advisory Committee and replaced them with anti-vaccine persons. RFK Jr. has also falsely linked vaccines to autism, falsely called COVID-19 vaccines the deadliest vaccine ever made, falsely said that mRNA vaccines contributed to virus evolution and are ineffective against variants of coronavirus. He further falsely said that vaccines do not effectively shield against upper respiratory infections like COVID and flu, despite evidence over the years clearly stating the effectiveness of vaccines. The Trump administration has canceled around $500 million in funding for mRNA vaccine development and canceled a total of 22 separate research projects.